Now back to Just Energy Radio with Dr. Rita Louise.
Hello and welcome back to Just Energy Radio. I'm your host, Dr. Rita Louise, and thank you all for staying tuned to the second hour of the show. In this hour, we're going to be speaking with Michael Joyer and Marc Micozzi about personal boundaries and your health and their new book, Your Emotional Type. But don't forget, Just Energy Radio is brought to you by SoulHealer.com and the Institute of Applied Energetics. That's AppliedEnergeticsInstitute.com. And you can check out all of our archives by going to the Just Energy Radio webpage. That's www.justenergyradio.com. And you can also sign up for our newsletter to keep informed of all the shows that we have coming up on Just Energy Radio. So let me tell you about our next guest and get them on the air. Michael Joyer, an emotion researcher and writer based in Washington, D.C., has been investigating the mind-body basis of personality and health for 15 years. Marc Micozzi, MD, PhD, is a national leader in the field of Complementary and Alternative Medicine, CAM, is an adjunct professor of physiology and biophysics at Georgetown University School of Medicine. He was the co-founding editor-in-chief of the first U.S. journal on the subject of CAM, that would be Complementary and Alternative Medicine, and he organized and edited the first U.S. textbook, Fundamentals of Complementary and Alternative Medicine, now in its fourth edition. And they're the author of their new book, Your Emotional Type. And let's welcome to Just Energy Radio, Michael Joyer and Marc Micozzi. Hi, guys. How are you?
Good afternoon. Good.
So, we're going to talk about your new book, and I really enjoyed it. And I wanted to open with reading a quote out of here. And my eyes are a little tired, and I don't have my glasses with me, so hopefully it will come out all in one piece.
It's okay. Mike has the whole thing memorized. He can tell you.
Half, anyway.
Okay. So it says research suggests that extroverts have high dispositional energy, a sense of innate vigor or active engagement with life, have dramatically lower levels of an immune system chemical known as trigger inflammation. The finding indicates that people who have extroverted and engaged with life may be better protected than other people against inflammatory-related illnesses such as rheumatoid arthritis, stress-related events, blah, 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 blah. So the question I want to open with is, well, what was the question? Okay, do our emotions and our way of engaging with the world affect our health?
Hugely. You focused, Rita, on maybe one of the most important passages in the book because it's very much in line with what science is finding, and that is tying feelings to health. And science is realizing what is common sense, I suppose, but it's very much in the news these days is how people differ. Personalities are different, the way people engage with one another, their attitudes, their feelings about their own lives, very, very different one person to another. And what we try to do in Your Emotional Type is to provide a very easy to understand and accurate way of assessing sort of where you are on a spectrum of emotional types that'll give you a sense of what types of illnesses you may be susceptible to because of the way that you process your own feelings.
A lot of people... Oh, go ahead.
Well, your quote, the quote that you chose from the book, that clearly, what we're looking at is how people experience the world and feel about what happens in the world and how they process their feelings. And you mentioned there in that quote the effect on the immune system, essentially. And, since the 1970s now, regular medicine, in terms of the research of the practice, has been struggling to understand a host of diseases which have become increasingly common, essentially the 12 major illnesses that we tackle in the book. And medicine cannot fully understand and explain what's happening, but we began to see that, in effect, the immune system is somehow attacking our own bodies for whatever reasons. And therefore these diseases became known as autoimmune, that is our own immune system attacking our cells. But why? And to some extent, it's synonymous with we don't really know what's causing it. And obviously, if you don't know what's causing it, you don't know how to handle it or treat it. And so what we think is that we're missing a dimension, or have been missing until recently, the understanding of how the mind and the body work together, how one influences the other, how our feelings are actually the key to understanding the physiology of what's happening in our body that affects our health.
There are a lot of people that, and I think most people these days recognize the effect that stress, and I'm using that in the way that it's reflected back to me, has in their lives. But when you ask them, well, what are you stressed about? They'll say, well, not really anything, even though they're manifesting some kind of health concern. Are there different kinds of stresses other than the overt, my car blew down, my car broke down, my dog died yesterday, kind of things that people typically associate with stress?
Well, lots of things are stressful, and the key is that different people experience the stresses differently. And we believe that there's a relationship to what we call your emotional type, or specifically in psychometric terms, your personality boundaries, and that in fact determines to some extent how a given person will react to the same type of stress. For example, a test pilot, like the Chuck Yeager, right stuff kind of guy, if he's sitting at a desk on base, that's stress to him. When he gets behind the aircraft, he's happy. The average person, if you put us, behind the controls of a supersonic aircraft, we'd be stressed out of our minds, and we'd be more comfortable sitting at the desk. So a lot of it depends on how we react to the things that are happening to us in our lives and in our environment.
Michael?
Well, I'd simply add to that when we talk about feelings, feelings are a reaction to what's happening in our environment. So the type of stressors out there are going to influence how we feel. The feelings are energetic, to kind of match up with the title of your show. They are energy. Emotion is what we can literally feel in our bodies. And so there is an energy behind it that connects to the physiology, that connects to the biology of what's happening in the body. But when people are stressed, their feelings are doing different things than when they're not stressed, and that will have certain consequences. Mark mentioned immune consequences. There are others. But it really is a matter of energy, and you can see that in the way that the word emotion is structured.
Does our body communicate with us?
Yes, we actually use the term body-mind, which connects up the body with the mind, because, as Mark can point out, there's constant communication. Every second that we're alive, there's communication in so many ways throughout the body-mind.
The concept of the molecules of emotion, which was coined by my colleague at Georgetown, Candace Pert, who also helped develop the identification of neuropeptides, like endorphins, that are natural painkillers in effect. We have these so-called peptide chemicals not only in the brain, but throughout the body, and in fact there are more neuropeptides in the intestinal system than there are in the brain. So when we talk about having a gut feeling, these molecules that transmit feelings and emotions, it really has a lot of meaning to understand what is actually happening in the gut to process feelings, which is a total body phenomenon. It's not something that is isolated and happening just in the brain.
It's like I'm not quite sure how you guys are going to play off each other, so I'm like, okay, big pregnant pause there.
But the way that happens is really different within different individuals. Mark was talking about Chuck Yeager, the test pilot, and there are certain people that we all know who we would consider unflappable, in a certain situation. And generally, people who are unflappable are that way in many situations. Their threshold for what gets to them is higher than for other people. We know other people who tend to fly off the handle, and what gets them agitated is not necessarily what gets somebody else agitated. It takes much less of a stressor to get other people to react. So these are real evident differences in people, in individuals. And what we've done here is to try and connect using the science, using the evidence from medicine that's accumulating. There's a field called psychoneuroimmunology, which really ties all of this together. As Mark was saying, the mind of the gut, the intestinal tract has its own brain, you might say, the second brain, which communicates with the brain upstairs. All of this is becoming better known, and what we try to do is relate the fact of feelings and the differences between people and how they feel and what stresses them with different health conditions.
When you were talking about Chuck Yeager and his threshold to, make it through certain experiences, one of the things that we were going to talk about, which I think is a critical topic, is boundaries. And so is there a relationship to our threshold to dealing with stress and our boundaries? Are we talking, I guess the question is, are we talking about the same thing or are we talking about two different things?
Well, again, the boundaries relate to how you're going to process and handle, how you're going to feel about these stresses. And our point is that in turn relates to what type of illnesses you may be susceptible to, which does, in fact, relate to your boundary type.
And on our website, youremotionaltype.com, there's an 18-question quiz, which is a very easy to take sort of template for where you are on what's called the boundary spectrum. The boundary concept, Rita, comes from a guy named Dr. Ernest Hartman up at Tufts University, and he's got a lot of research into personality, and he initially actually started his research by looking at dreaming, and the people who were more susceptible to having nightmares, in other words, the stresses really from everyday life intruding on their non-waking hours into their sleep. And he started noticing certain correlations about the people who have real vivid dreams and other people who may not even remember their dreams. Their dreams are kind of pedestrian in contrast, and they may not dream very often in color. Their dreams are sort of unexceptional. There's not a whole lot going on there. The opposite of vivid dreams. And he realized that people really do handle stresses differently. And the boundary spectrum is a way of understanding sort of people on one side would be definitely thick-skinned, you might say. And on the far other side, you have thin-skinned people who react to lots of things very overtly. And everyone can be, somewhere along the spectrum at some point in their life. It's not that you're fixed, in that spot forever, but it's a good indication as far as just typically how you handle things. And that's a way to understand how you act and react in the world.
Do these boundaries control our feelings? And I guess what I'm saying is, like, if you're thick-skinned, do you have less feelings than if you're thin-skinned kind of thing? I mean, is there a correlation between the two?
A great question. Mark, do you want to handle that?
Well, again, in the practical terms we've looked at, it really comes back to the effect that it's having inside of us, because even the thick-skinned person who seems like they're impervious and nothing bothers them and nothing gets to them, when we look inside and see what's happening, it is having an effect on their physiology. Whereas, the thin-skinned person, it's going to be more obvious that that they are being affected by things. And again, the way their physiology responds is different and sets them up for different kinds of illnesses down the road. So, the value of what we're doing is to be able to point people in the right direction and say, you may not be aware of what your emotions are doing to you, but in fact, there are consequences to thick-skinned type, which are different from the thin-skinned, but everyone is susceptible to certain problems, and accordingly, people with thick boundaries will respond to some therapies better than others, and likewise with the thin-skinned person or the thin boundary person, they will respond better to some therapies than to others, and different from what we see with the other end of the scale.
That's
so
interesting.
Help people find the help that they need for them.
Yeah, because, I mean, when I hear the word thick-skinned, I think of someone who, and correct me if I'm wrong, that's, what we're here about, of someone who just might take a lot and deal with a lot of experiences, but then end up with high blood pressure because they're not expressing their emotional self.
Exactly. And what
yes,
happens then if you link it to the therapies that can help, prevent or manage these stresses and the effects they're having, you may not even be aware till you go in for something like biofeedback, and you can actually see that while you're maintaining this surface of calm and being unmovable inside, your body is reacting. And so the biofeedback, as an example of a therapy that can be helpful, actually gives you the information. Look at how your body's responding. Look at how your blood pressure is reacting and the effects on the circulation. And so in turn, it gives you the information to, number one, understand that you may be thick-skinned on the outside, but you are still having emotions and processing feelings that affect you on the inside. And in fact, this particular therapy can give you the tools you need to get a handle on what's happening and to influence that in a positive way.
It's a very different way of looking at the conjunction of personality and health than I think medicine has appreciated up till now, because the idea is pretty much, you go to your doctor, you say, well, this is what I'm experiencing, these are my symptoms, and the doctor says, well, this is what you got, and this is what you take for it. And there's not a whole lot in that exchange that suggests that your experience and even the way you're experiencing your symptoms, not to mention what might cure them or alleviate them, is going to be any different from somebody else. And yet the fact of the matter is, people are so different.
It's all about emotion, feeling, essentially all about energy. It's just energy. And the problem with medicine has been that it's, they'll look at everything but energy. And, I remember when I was working in Pennsylvania, our Senator Specter was very supportive of trying to explore, innovative approaches, which really the therapies we're talking about are innovative. They offer different options and different solutions to people than drugs and medical procedures that look at the mind-body connection and look at the energetic aspects and make use of that. I remember Senator Specter went to the National Institutes of Health and asked them to study bioenergy, and they told him, well, we don't believe in bioenergy. So I suggested to the senator that he ask the Department of Energy to study it because they don't believe in energy. That's the way things work here in Washington, I'm afraid.
Well, I mean, and for me, this is what I do is, I'm a medical intuitive, and so people come to me because they have some kind of owie going on. We'll talk about what's going on physically, but where I feel they get the most value, or I hope they get the most value, is understanding what the belief or what the emotion is that they're holding on to or not resolving that is actually causing the illness to occur in the first place.
Yes, we often talk about feeling stuck. Some people feel stuck. They don't know why. Depression is probably as good an example of that as possible. People are stuck and feeling down, but they don't quite know why, and they don't seem to have a way to get out of it. Although there are very good reasons why they would feel that way. Depression is a part of who we are, at least some of the time. But there are feelings there that are probably stuck, and there are, people when they say they're feeling better, generally, their energy is moving better. They're feeling freer. They're feeling more able to express themselves and understand what it is that they're feeling. So there's a whole, way of looking, as Mark said, at the way that the feelings are energetically, and that has very much to do, we believe, with the actual symptoms they're experiencing.
I mean, I don't know where your research takes you, but one of the things that I have noticed is kind of an increased level of depression in young people because they really haven't ever been tasked to do anything. And so then when they grow up and they have to enter the regular world and maybe get a job or go to school and study, they find that they're not equipped to handle that. And I'm wondering if in your work you have seen correlations like that or increases in young people in depression.
Well, and I want to add to that, and I'm sure Mike will have something to say about how things track over time or at different ages. But, add to what you said about the younger generation and the fact that as they've gone through school, it's for a lot of people it's an artificial environment. It kind of emphasizes the left brain as opposed to the right brain. So people that would have done very well, in nature and as a hunter-gatherer in our human history, suddenly they're in a classroom and it's sort of artificial learning, and they may not do well. And so, if they have challenges with learning, they're given drugs and pills. And then they grow up to be adults, and lo and behold, the child psychologists who pump them full of medicines, well, they get to be adults, and the adult psychologists have no idea, how to transition somebody from these drugs to the normal life. And so just add that to the picture of what you're saying in terms of the challenges of this generation. But I know Mike's looked at the consistency, really, of somebody's emotional type, boundary type, and there is a consistency from childhood into adulthood.
Yes.
So it's not going to change a great deal as one gets older.
And some of the experiences, Mark, that people have, especially if they're traumatic experiences when they're young, these seem to have repercussions well into adulthood, so that there is a fair amount of evidence now. In fact, they're recovering more and more evidence that any number of conditions, whether it's irritable bowel syndrome, whether it's fibromyalgia, chronic fatigue syndrome, migraine headache, PTSD, all have connections in many cases to traumatic experiences that people had when they were younger, and they sort of filed those away. But the sort of residual energy of what they went through has sort of been out of sight. It hasn't been completely out of mind because it asserts itself later on. Maybe there's a trigger, something that occurs later in their life, and they suddenly seem to contract irritable bowel syndrome, or migraine headaches become an issue for them. Certainly skin outbreaks of different, skin diseases, psoriasis, eczema, and so forth. The skin is a very reactive organ, and so you talk about kids, teenagers, obviously a lot of that is just typically biological, but people do react, their skin reacts considerably more for one person than another based on the stresses that they're under. Asthma, another condition like that. There are actually a dozen of these chronic conditions, we call them the dozen discomforts, that we address in the book, and we try and explain, here's the evidence connecting these conditions to where a person is on the boundary spectrum, how they feel their feelings, or the extent that they don't.
Do you find that certain issues go more with someone who, in your terms, is more thick-skinned versus thin-skinned? And can you kind of, share that part?
Yes. I mean, just to give a couple of examples, you mentioned high blood pressure, and hypertension is certainly correlates with a thick boundary approach. The type of person who sometimes they're called type C people, who just sort of take it and take it and take it, I think was the way you put it, and it manifests itself in hypertension, sometimes without the person being aware that they have high blood pressure. A similar case would be ulcer. A thick boundary person is more likely to develop an ulcer around issues that are not quite in their awareness, but there's certainly a lot of energy around the feelings relating to those issues. So those are a couple of examples of what we call thick boundary conditions, or conditions that are more likely to affect the thick boundary person.
And it sounds like, the person is just going to, blow up on the inside. If you kind of give it a visual, it's like, wow, they're going to blow up.
One of the people...
Or they are erupting.
Yeah. One of the people we quote in the book is a guy named James J. Lynch, who conducted a great deal of research on hypertension in his lab. I think it was at the University of Maryland in the 1980s. And his work was featured on 60 Minutes and other places, and attracted quite a lot of renown at that time, and deserves really to be re-recognized. And he looked at people who would say that they were perfectly fine. They resembled, at least one example he gave, there's a woman, a patient that he was seeing, who reminded him of the Mona Lisa because she was sitting there very placid, but her skin was much more pale than it should have been. And her pulse was elevated, and all the other indications were she was under a great deal of stress, but she didn't know it. Her body was speaking, but she didn't know it.
I think one of the things that really impressed me, that I think we came to a new understanding of something that's really confused medicine for many years now, is this whole syndrome, which has become increasingly common, of what's lumped together as chronic fatigue fibromyalgia. And what is that really? And, some people are sort of at one, more chronic fatigue, others are more fibromyalgia. Well, what we found clearly now is that it's sort of it's reacting to the same kinds of stresses and overload in life, but someone who's very thin boundary is going to manifest it at the fibromyalgia end of the scale. And someone who's thick boundary, they're going to come down with more of a chronic fatigue. So, yes, there is a spectrum of this, let's just say, exhaustion syndrome that we see today in the modern world of chronic fatigue fibromyalgia. And what we find is that relates to the chronic fatigue end is if you're at the thick end of the boundary spectrum, and the fibromyalgia end is if you're at the thin end of the boundary spectrum. So we think this has been quite helpful in understanding this mysterious problem that we've had such a hard time treating. And so likewise, knowing about your boundaries, we are able to suggest the therapies that are going to be more helpful if you're on one end of the spectrum versus the other.
And see, I think that's interesting how you make the correlation of one end of the spectrum to another, because from my perspective, when I work with people with that disorder, I call it the giving disease, because they just give everything away and they don't take care of themselves.
And if you're a thin boundary person, you end up sort of with fibromyalgia, and if you're on the thick end, it's more like the chronic fatigue end of that spectrum that we see.
Interesting.
It's interesting because
those folks
who give
figuring
and
out,
give.
but this is one of the ways that I think we've really found something that's new and valuable in terms of understanding these kinds of problems and what you can do about them.
One of the folks that has endorsed our book is a physician by the name of Gabor Mate, who works out of Vancouver, up in Canada, Western Canada, and he works with a lot of those patients who, again, I guess the term he uses is a type C personality, which is someone who just sort of plows ahead, gives and gives and gives of themselves, doesn't really pause to consider what the ramifications are for them, for themselves, and they give until the point that they can't give anymore, and then they have to take care from somebody else because they're flat on their back. They're suffering from chronic fatigue or some sort of other illness. Rheumatoid arthritis is one example that he gives, and there is evidence that we present in the book that suggests that really is indicative of a person like that who is more on the thick boundary side of things.
So if you're a person who can't say no, you keep giving and giving and giving until your body itself says no.
But that's not indicative of being a thick-skinned person or a thin-skinned person. It's just that's your behavior, and then based on whether you're thick-skinned or thin-skinned will depend on how your body manifests the disagreement.
Exactly, and that's what we think one of the things we found here in this book.
And so in doing, you mentioned on the website, but in the book there was a much more comprehensive questionnaire in there. But once you determine whether you're thick-skinned or thin-skinned, or can you be thick-skinned in certain areas, kind of like the Myers-Briggs test, you have these different characteristics. And so when you do this test, can you be like thick-skinned when it comes to personal relationships, but thin-skinned when it comes to taking care of yourself? I mean, are there characteristics like that, or
so
do
the
you
Myers-Briggs is a good example because that's a psychometric scale that people are familiar with and used all the time in management. The boundary type is just another one of these psychometric scales. It's kind of got the same kind of science behind it. But with the Myers-Briggs, you really are measuring 4 different axes. It's sort of like a 3-dimensional chess game. But as far as the boundary types, it's really just one spectrum, just a single line.
Okay.
And you're on one end or the other. So, as a psychometric instrument, it tries to approximate reality. It tries to describe reality. It's a tool. It's a device. But we're talking about a single scale of thick to thin, as opposed to a Myers-Briggs, which is also psychometric, but looks at 4 different kinds of scales, if you will.
Okay, so you're just going to fall on that scale somewhere.
Between thick and thin, right? It's just like a spectrum of light, and your score relates to where you fall on that scale. And we found that scale to be valuable because it matches up to the kinds of illnesses you're susceptible to, and it also matches up to the kinds of therapies that will help you more than others. And that's been a very important thing because, we know that there's a lot of so-called mind-body therapies that are effective. There's lots of science to say these are effective, but we also know that in practice, not everything works for everybody. And so we've needed to understand better how to direct people appropriately. And the only way where we've had any guidance like this in the past is with hypnosis, where, it's been used for 150 years. We know it can be very helpful, but we also know that some people are susceptible to hypnosis, others are not, and most people kind of fall in between. So if you can predict who's going to benefit, everyone's better off. And so there is something called the hypnotic susceptibility scale that's been accepted, in practice. And what we've really done, and something I've argued for years with people who practice this type of medicine, is to develop the same types of scales for how their particular therapy is going to work or not work for a given individual. And we haven't had that until now.
And I don't want to leave that topic, but I have one more question that's kind of burning in the back of my mind. When you evaluate the thick skin and the thin skin, is there any correlation to like left brain, right brain personalities?
That's interesting. There's not one that jumps to mind. However, what we have found in previous research that we've done, which focuses on environmental sensitivities and to some extent emotional sensitivities, is that people who are ambidextrous, people who can use, right hand or left hand for most things, these folks tend to be highly sensitive and therefore are on the thin boundary side of the spectrum. So I'm not sure about right versus left necessarily, but we did find some a rather significant statistical result that jumped out from some other things, that people who are ambidextrous seem to be more sensitive, and that does correlate with thin boundaries.
We're not aware of the actual science and studies that have been done to relate specifically the left brain, right brain issue to the thick boundary, thin boundary scale. But just knowing generally about the biology of the brain and biology of humans is that, my thought would be that the left brain, someone who's a very dominant left brain person would be more on the thick boundary, and someone who's a very dominant right brain person would be more on the thin boundary. That's just my hypothesis, based upon the work on right and left brain and the work on the boundaries. But there hasn't been the direct analysis of it that we're aware of. But that would be my thought.
Well, and that was kind of my thought, but I just thought there might have been some kind of study or look at that.
That makes sense, doesn't it, Rita?
It does. Yeah. But that's what I do. Okay, let's go back to therapies. So you talked about hypnotherapy, and in your observation, my hit would be that it wouldn't really work with thick-skinned people because they tend to be kind of on the stubborn side.
Exactly. And in fact, hypnosis is like the classic. If we look at our actual analysis, which is in the book, the hypnosis is the paradigmatic treatment for a very thin boundary person. And so now we really understand, when we go back and look at the idea of hypnotic susceptibility, that's been out there for a while. We now see that hypnotic susceptibility really means a thin boundary. And but we also look at 6 other mind-body therapies, as well as acupuncture, where we've had no idea, how to predict or understand why some people respond and others don't, and now we can relate that to the thin and to the thick.
And can you give some examples? I mean, when I have a client where I would use the word that they're thick-skinned, I have this 14-inch cast iron frying pan that I think, well, maybe if I just clunk them on the top of the head, it would work. Very medically sound advice. But, sometimes you think that. And so having because I think working with thin boundary people, thin-skinned people is easier. Maybe they're more manipulative. Maybe you can manipulate them easier. I don't know, but I just say
they're more suggestible. Hypnotic suggestibility is the whole key. So they're more open to suggestion because actually they can tell. They can tell that they're responding and their feelings are changing, whereas the thick person doesn't know what's going on inside until you clue them in. And so you move to something like biofeedback, which will help the thick boundary person get a clue as to what's actually going on, because biofeedback literally tells the practitioner and gives the information to the patient, this is what's going on inside of you. And so that's why we think it works a lot better if we use a technique like biofeedback in someone who's thick boundary. You don't have to use biofeedback in a thin boundary person because they're getting all the feedback they can stand, And so we take different approaches.
And some of the therapies that help reduce stress, whether it's meditation, whether it's yoga, whether it's mindfulness-based stress reduction, those approaches are going to help pretty much everyone, but especially a person with thicker boundaries, because it's going to help them to get centered and to relax a little bit so that they're better able to sort of focus on their feelings and better able to make use of, for example, biofeedback or acupuncture for that matter. So any therapy that helps to reduce stress is going to be especially beneficial to a thick boundary person who may not even realize they're under stress.
Are there more issues associated with someone that has thick boundaries?
It's not that they're more, it's just that they're different. I think that the key here is that the person with thin boundaries, may look like they have a lot of issues, but it turns out that, everyone has issues, and it's just they feel them differently is what it boils down to. And with that knowledge, we can now measure it with the thicker thin boundary scale. We can understand what problems they're going to be susceptible to, which are different depending upon your personality boundary type. And now we can suggest what therapy is going to be more appropriate than another one. And this is what we've sort of struggled with in learning how to apply all these wonderful mind-body therapies that have been out there.
Is the goal with working with the therapies, obviously there's the health part, but is part of it, in your mind, a goal to help them become more centered in this scale of boundaries? Or is that a result of some of these therapies?
Well, we just started thinking about that lately, just based upon some of the feedback we get talking to people. And, as a physician, of course, I focused on understanding what illnesses you're going to be prone to, what treatments are going to work. But actually, there really is a much broader perspective on just dealing with the day-to-day, exigencies of life, if you will, that understanding your personality type can help you go and maybe do some things that will help you manage lots of things in your life, not just waiting until you have an illness, but in fact, prevent certain things if you know you're susceptible to them and you know what types of help you can get. You can act early, before while you're still basically healthy, before your body has developed a stress-related illness, if you will.
It could also help, Rita, in terms of interpersonal relations. Having worked on this book for the last couple of years, I can tell you that in our family of 4, we have different boundary types, and even my kids, who are at an age now where they can begin to understand this concept, I think it's helped them to kind of see differences from one person to another. So my daughter will say from time to time, I'm feeling stressed, I'm feeling out of sorts today. I realize I'm thin boundary and more stuff gets to me. So she realizes that she needs to take a break. So she also understands that there are other people, her dad among them, who can sort of just plow ahead and not realize that he's sort of overextended, and then he does something foolish, or does something that just sort of pops up on the computer screen, and he blows a gasket over something. So I'm definitely more on the thicker side, and it has quite honestly helped me and helped others in this family to understand the dynamics, that people are not all constructed the same way, and that energy of feelings works differently in different people. And it helps really people to understand themselves and others.
Where you had asked earlier, how do Mike and I kind of work together, key off one another, and what we found out is that Mike is more thick boundary and I'm more thin boundary, and that has helped us to sort of understand how the other person works and approaches things and try to get a book written, for example. So
it is similar in that way to Myers-Briggs. People look at each other and see, they want to see what they want to see, but that's not necessarily what the other person is feeling or going through. And to sort of appreciate those differences helps folks to, get along better and be more productive.
Yeah, and when you think about the Myers-Briggs, I used to, run, sort of mid-sized organizations. I might have 50 people working for me, and we'd go through these Myers-Briggs exercises, and people would be very surprised that essentially I was more what correlates to being thin boundary, because as the boss you have to look like you're a thick boundary kind of person, and people would be surprised. And I was actually surprised myself to some extent, how in the kinds of positions I got myself into, they really were not ideal for a thin boundary kind of person. But you sort of learn how to put the mask on that is expected of you in different situations. But the key about what we're offering here is to really learn about yourself, whether it's how you're going to interact with people, or more to the original point, which is what your health risks might be and what kinds of treatments are going to work for you.
It's funny, Mark, when you talk about organizations, there are a couple of questions among the 18 in the short form boundary quiz that relate to organizations. For example, one of the questions or statements people can agree or disagree with is a good organization is one in which all the lines of responsibility are precise and clearly established. Well, some people who agree with that, they do quite well in hierarchical organizations. Others, that would drive them up the wall, and it really helps to go through the quiz because there are other questions like that, and people can really get a better sense of maybe why certain things get to them and others not.
So one of the things that you also talk about, which of course is a juicy topic for me, is energy medicine. And so you mentioned acupuncture. I mean, do you consider like the biofeedback energy medicine, or are you talking a little more about, hands-on healings, flower essences, or stuff that, the more lay community would put in the energy medicine category?
Right. Well, I mean, again, the practical aspect here in terms of using this as a self-help guide is that we focused on the therapies that have been around, that have lots of medical research now. They're widely available, and you can't really do a scientific analysis of a therapy versus a boundary type if you don't have a lot of studies. Mm-hmm. So when you get to the the pure energy medicine that you're talking about, there's just less data, because it's been difficult to study. People aren't interested in studying it to that extent. The funding isn't available, and some of those challenges. And so there's less scientific data on the pure energy. And then you pass into the realm of the intuitive healer, which has been known throughout time in all cultures. And I mean that person doesn't need scientific data to do their work, whereas the doctor we're all trained, well, you've got to be science-based, and the whole emphasis has been on, quote, science. And, of course, what we find is that when you finally do the science on all these biomedical therapies, they do work. But the next step is to be more precise in understanding who they will work best for, and being able to tailor your therapy to the individual. Everybody's different, and of course the intuitive healer sees that right away without the need for a lot of science. If you look at what we do in our everyday lives, I mean, we think that we're rational and scientific about things, but in fact, most of what we do every day is based upon how we feel about things. We're not doing little scientific tests to get us through the day, and that's where everyone has intuition, and some people develop it, but by and large, we talked about the children. I mean, they're taught not to trust their intuition. They're not. Many people lose the abilities to have these sensitivities to energy, which I think basically people are born with.
One of the things. Oh, go ahead.
Well, it just occurs to me with Chapter 8 in our book, which is the final chapter, I think that is maybe an entree into doing some further research, as Mark's pointing out, on these energy therapies, because they are very much, I think there's momentum behind them. They're very much therapies that people are interested in. Everything, from massage and Reiki to other forms of therapy, meridian therapies and so forth. It's kind of a hot topic. There are a lot of folks like yourself who know these therapies through and through, have practical experience to lend, and there are organizations such as there's a group called the Association for Comprehensive Energy Psychology, which has begun to assemble a lot of studies showing what types of energy medicine work better for some of these different conditions. So I think what we tried to do in the final chapter of the book, even though we don't have all the evidence to be able to say which of the dozen discomforts these different energy therapies work better for, aside from acupuncture, which we do have data, is it's sort of a place mark. We're sort of explaining why we think that this is a direction that folks ought to move, and explaining, especially to folks who may not give that a whole lot of credence, that there's something here that needs to be further studied.
Okay, looking at the clock, got a couple minutes left. So if someone goes online, and it's on, somebody posted this, youremotionaltype.com/boundaries/quiz, but youremotionaltype.com, where the quiz is, and they take the quiz, and they find out they're and I'm going to do this for both sides, you're a thick-skinned person. Just briefly, what kind of therapies tend to work better for a thick-skinned person? So let's say they don't have chronic fatigue, but they have, I don't know, they've manifested diabetes or, some other illness, and they're looking to utilize some kind of energy medicine or biofeedback for themselves. What would be a therapy that would be more effective for a thick-skinned person than a thin-skinned person?
Well, Rita, we're pretty clear in sort of talk about boundaries, pretty much setting up some boundaries as far as which conditions we think that the mind-body therapies are going to be able to affect. Diabetes is not in there because we consider that more an illness as opposed to disease as opposed to a chronic illness. Diseases, the way we look at them, are not as subject to emotion. There are biological reasons for them, and if feelings play a role, they don't play as major a role in some of these conditions, leukemia, AIDS, and so forth, versus some of the other conditions we've talked about, whether it's chronic fatigue, whether it's allergy, asthma, ulcer, migraine headache, fibromyalgia, etc. That's really where we focus our attention, and the book I think gives some pretty good guidance on whether if you have any of those dozen discomforts, which of the super 7 therapies, we call them, the 7 that there's greatest evidence for helping, which ones are going to work. You mentioned thick boundaries, and I think Mark had said biofeedback is a good example of a type of therapy that's going to help a person on the thicker side of the spectrum. It's not the only one. It's just an exemplary.
One of the things, I don't remember, I think it was you, Michael, that said about your daughter, about her making the comment that she felt like, she was feeling kind of thin-skinned. And I guess do our boundaries fluctuate throughout the day or over time? Can we be thick-skinned at one point and then be kind of thin-skinned at another point?
Yes. Ernest Hartman, who developed the concept of boundaries and has written many books about them, talks about boundaries as being something that certainly aren't fixed. A person can go through their day, and yes, as their energy changes, they're going to be feeling comparatively thinner about something versus something else later in the day. And, of course, as they change personally, as their experiences change them, as they get older, we talk about some people who, their habits and their approach to life changes markedly from when they were younger. Other people seem more open to experience and to become thinner as opposed to thicker as they get older. But generally speaking, as folks age, the tendency over the whole population is, the expectation is that the boundaries are going to get thicker as they get older. That's not, it's only a general observation. Likewise, women generally are thinner boundaried than men. Of course, that's not true for every man and every woman, but just general observations.
Interesting. Well, our time is nearly up. If somebody wants to get a hold of the book or get a hold of either one of you, what would be the best way?
Well, go right to the website.
Okay, one at a time, you guys.
Yeah. I'll defer to Mark on that, yeah.
Yeah, we have a nice website that gives you all the information. It's just, www.youremotionaltype.com, and that's the title of the book, Your Emotional Type. And you can figure out how to get a hold of us that way. And I've actually had people get a hold of me because they've taken the survey and they really want to explore further what all this means.
All they need to do is click on the tab that says Further Info, and once they do that, there'll be a selection of options, and contact information is under Further Info. So it's just a couple of clicks once they get on the website, and they can send an email to Mark or to me or to both.
Excellent. And that's where the questionnaire is also.
Yes, right on the splash page.
Questions, the short version, and then you can also order the book, which has the short version. We actually have people take that in the middle of the book so they can understand, what we then present in the second half of the book. And at the back of the book is the full, many questions that takes quite a bit of time. But we have found that the 18-question version, the short version, pretty much captures the essence of what you would get if you were to spend, hours answering hundreds of questions. There's something about those 18 questions that captures the information that you need to figure out where you fit on the boundary scale.
Okay, well, great, but we're almost out of time before we get cut off. So I'm going to let you guys go. Thank you for coming on the show. That was Michael Jower and Mark Micozzi, their book, Your Emotional Type. Next week, Scotty Alley Robert. Till then, be blessed.
Join host Dr. Rita Louise each week at this time for Just Energy Radio. Point your browser to www.justenergyradio.com for more show information and to contact Dr. Rita.